everyone, it's Kenzie, and my group that worked together was myself, Emily, Peyton, and Grace, and our case study was on a patient with schizophrenia. Our client's name is Lauren, and she was a 31-year-old female diagnosed with schizophrenia. She has a history of being admitted to an inpatient mental unit upon her initial diagnosis, and after her condition was stabilized, she was discharged to outpatient OT, which is where she is currently. She works full-time, 3 12-hour shifts as a nurse, and she'll occasionally work extra a couple times a month. Her main roles are a wife, mom, and a nurse. Her routines is attending church every Sunday morning with her family, and she values working hard, spending time with her family, and helping others. Her environment and social contexts include a 2-bedroom home that she lives in with her husband and kids, and she doesn't have any other family members that live nearby for support. And as mentioned previously, she works full-time, and her nurse coworkers are her closest friends. Her diagnosis has impacted her daily performance in regards to her relationship with her husband and her kids, as well as her coworkers, which is a big concern for her, and has also impacted her ability to perform tasks at work, her ability to perform IADLs, specifically raising her kids and keeping up her home, as well as keeping up finances. And she was referred by her primary care physician for outpatient OT services.
One of the frames of references we chose was the psychodynamic frame of reference. With this, the conscious and unconscious minds work to satisfy basic needs and maintain relationships. Also, insufficient ego functions result in dysfunction and inability to maintain relationships, such as in her marriage and at work. One of the approaches is an explorative approach. With this, it brings unconscious thoughts to the conscious level to resolve maladaptive thought processes and allow for self-expression of feelings. Another approach is a supportive approach. This strengthens ego functions and addresses self-defense mechanisms. This frame of reference also assesses social interactions and uses activity analysis.
The next frame of reference we used was the model of human occupation. Occupations are based on intrinsic characteristics including volition, habituation, and performance capacity. These contribute to the environmental conditions the client experiences. This frame of reference will consider the client's inner motivation and engagement in occupations. The roles of wife, coworker, and mother are important to the client, and under habituation, roles can be a focus of the intervention to help develop meaningful relationships with her husband and coworkers. Performance capacity will include both mental and physical abilities of the client's performance, which is important for the condition of schizophrenia.
The first assessment we are using for this case is the COPM. We all do know about this, but I'll go over the assessment protocol quick. So there's the semi-structured interview, which identifies concerns and problems that Lauren is experiencing throughout her daily occupational performance. Lauren will then choose her top 5 most important problems that were discussed and rate them based on her performance and satisfaction with the task. These ratings will be out of a scale of 1 to 10. And then after the intervention, the client will complete a follow-up rating of her performance and satisfaction with the same tasks and the same rating scale. The expected assessment results from the COPM would be that we will be able to gather a better understanding of Lauren's concerns in her daily occupations to guide our treatment and interventions. Lauren's diagnosis of schizophrenia impacts her ability to perform many IADLs, hindering her daily occupational performance, which is why this is relevant to the COPM. We related the COPM back to the MOHO model due to the fact that Lauren's thoughts and feelings regarding how capable and effective she is described by volition throughout the MOHO model. And performance capacity is also a key characteristic of the MOHO model, reflecting the impact of Lauren's diagnosis on her performance in daily occupations. Evidence we found relating the COPM back to this case is a study using the COPM was done involving 9 clients who have been diagnosed with schizophrenia. OT intervention was done over a 12-week period of time. Data was collected at the beginning of the intervention and then again at the end regarding the client's performance and satisfaction with their occupational performance of their chosen occupations. The results showed a significant change in the overall client performance and satisfaction post-intervention.
Another assessment that we thought would be important to use is the role checklist, which takes about 15 minutes to administer, and it is appropriate for use with a variety of populations, including the age of our client Lauren. And it is divided into two parts. Part one includes the major roles that this person uses in their daily life. And then part two identifies how valuable they feel that those roles are. From that, we are expected to determine what roles are most valuable to Lauren and then prioritize those areas for intervention to make them more client-centered. And the relevance to this diagnosis is that Lauren has roles of a wife, mother, and coworker, and those are all currently impacted by her diagnosis of schizophrenia. Using the role checklist is supported by the MOHO frame of reference because roles are a focus under the habituation portion of MOHO, and they represent social and cultural ideas about this person's own identity. And bringing awareness to Lauren's roles will help intervention strategies that are meaningful to her. Some evidence that we found to support using this assessment was one study that was done on adults who have schizophrenia in a rehab to work program. Data was collected from the role checklist in this study to look at the perception of roles and quality of life. And the study outlined importance for occupational therapists to include roles in the lives of their clients, especially the ones that they value the most.
The next assessment we decided to use was the COPE inventory. A little bit about the protocol. Clients respond to each coping mechanism listed by ranking each item from 1, I usually don't do this at all, to 4, I usually do this a lot. You sum each category of coping mechanisms then to determine which are most frequently used. Some expectations of the assessment and assessment results are that Lauren is expected to identify the use of maladaptive coping mechanisms due to decreased occupational performance. This is applicable to Lauren because she experiences stress during and after hallucinations and overall coping with her diagnosis. Poor coping mechanisms relate to defense mechanisms from the psychodynamic frame of reference. Coping mechanisms should be addressed to increase Lauren's self-awareness of her stressors and anxiety, as well as strengthen her ego functions. This is an example of using a supportive approach. As for evidence, a cross-sectional survey was conducted to determine problematic internet use, PIU, in students with schizophrenia spectrum disorders. The brief COPE inventory determined that individuals with schizophrenia have higher instances of using maladaptive coping mechanisms as well as PIU. Further screening is recommended for those who score high for using maladaptive coping strategies.
The next assessment we decided to use was the Coleman Evaluation of Living Skills. The assessment protocol is observation and interview-based and evaluates the function of basic living skills. This assessment also assesses ADL's cognition, communication, life participation, and occupational performance. The expected assessment results is identifying specific areas in which Laura's daily living skills are impacted due to her diagnosis of schizophrenia. This assessment is relevant for Laura because daily living skills of those with schizophrenia are disrupted in several ways, which includes cognition, perception, sensory motor, psychological, and psychosocial well-being. How we related this to the frame of reference is the assessment of performance capacity, both cognitively and physically, in the task of daily living skills is supported by the MOHO. These tasks are valuable to Lauren as they are responsibilities she has in her life as a mother and wife role. Lauren has the inner motivation to complete these tasks as well. The evidence we found is patients with schizophrenia generally require most help in areas of self-care, safety and health, money management, and leisure activities. A study done by Tabrizi found that living skills of individuals with schizophrenia would be impacted as a result of progression of their symptoms. Areas of maximum assistance required were found to be the same areas listed above in the Kazazi study.
Our first targeted outcome for Lauren would be to increase leisure activities with her family. So intervention specifically is to focus on Lauren's relationships with her husband and her children, which have been negatively impacted by her diagnosis. Incorporating physically active leisure occupations such as walking with her family to work on improving relationships and improving quality of life is our main intervention focus here. One study found that those with schizophrenia that are not physically active have been shown to have increased negative symptoms, increased medication side effects, and lower self-esteem than those who are more physically active. We related this to the MOHO model, that as Lauren should ultimately incorporate these activities into a structured routine and make them habitual. MOHO states that habits and routines are what provide structure to daily life, which is something Lauren needs considering her diagnosis. Ensuring that the activities are valued by Lauren will also address intrinsic factors, which will improve occupational identity, competence, and adaptation. The role checklist identified that the role of being a mother and a wife is important to Lauren, which is why we created this targeted outcome in general.
The second targeted outcome we have for Lauren is to improve coping mechanisms, and our intervention will specifically be to come up with coping strategies that will help Lauren improve her participation in daily occupations. We found a specific type of intervention called the Awareness and Coping with Emotion in Schizophrenia, or ACEs intervention, which specifically focuses on emotional awareness and coping skills. The content of this intervention is noticing daily positives and savoring gratitude and altruism, mindfulness, positive reappraisal, identifying personal strengths, and setting attainable goals. The evidence we found to support this intervention is those who participated in this specific ACEs intervention showed increased motivation to attend more sessions and reported positive feedback overall. And we would use the COPE inventory assessment specifically for this intervention because through this, Lauren will be able to identify the coping mechanisms she uses that may be maladaptive to her occupational performance and find ways to improve those. This assessment will also bring awareness to occupations or activities that cause stress and can help Lauren in developing strategies to decrease anxiety and stress when in these situations. And mechanisms used for coping relate to the psychodynamic frame of reference, which explains defense mechanisms used as maladaptive coping strategies. Journaling is also supported as it helps to bring conscious awareness to both conscious and unconscious thoughts that Lauren may be having.
The last targeted outcome is to improve IADL performance. For the intervention we planned, Laura's ability to manage her family's finances and bills have been negatively impacted. For this, we'll develop an individualized working budget with income and expenditures and a system to track daily spending. We'll also develop strategies to modify the budget based on changes in their income. We'll also encourage the use of a planner or reminders app to give alerts of upcoming due dates. Another intervention we've planned is to observe and bring awareness to Laura's health and safety, which has been negatively impacted, putting her at risk for independent management of her medications and daily tasks like cooking. We'll create a schedule of cleaning and household tasks that need to be completed each week. As for the evidence, a systematic review by John et al. Found that skill-based interventions yielded significant improvements of occupational performance for patients with schizophrenia. The Coleman Evaluation of Daily Living Skills and COPM will identify areas for improvement in functional occupational performance in daily tasks. In addition, the COPM will identify which daily occupations are the most meaningful and important to Laura's daily life. The MOHO frame of reference will assist us in guiding our plans for intervention to ensure that treatment is centered around activities which are relevant and meaningful for her daily life.
Our first goals focus around increased leisure with her family. The long-term goal is Lauren will go for a walk with her family to improve relationships with her daughter and husband 4 days per week for 4 consecutive weeks, independently, in 3 months. The short-term goal is Lauren will identify 3 different leisure activities she can complete with her family to improve her role as wife and mom with less than 2 verbal cues in 2 weeks.
So for our interventions for improving coping mechanisms, our long-term goal would be that Lauren will engage in her chosen coping strategies learned at ACEs intervention while experiencing stress due to hallucinations to improve self-regulation 8 out of 10 opportunities independently within 3 months. Our short-term goal is that Lauren will identify 3 coping strategies that will reduce symptoms of stress associated with hallucinations with less than 3 verbal cues in 2 weeks.
The last goal we have for Lauren is to improve her IADL performance. Our long-term goals is that Lauren will follow a monthly budget to manage her family's finances 3 out of 4 months independently within 6 months. Another goal is that Lauren will manage her daily medications for her schizophrenia with 100% accuracy independently within 2 months. The 2 short-term goals we have are that Lauren will create a weekly budget to manage her family's finances with minimum assistance within 3 weeks, and Lauren will organize her daily medications in a weekly pill organizer at the beginning of each week to help manage schizophrenic symptoms with less than 3 verbal cues within 3 weeks.
And here we have our post quiz. If you go ahead and click the link, it shouldn't take you too long. And lastly, here are our references. Thanks for listening.